Hi, I am Dr. Krishan from Teaching Hospital, Badulla, Sri Lanka. Today we are going to discuss what are the causes for the testicular pain. So if you want to contact me from the overseas people through WhatsApp, you can contact 0094 777 356245 or local people 0777 356245. So what are the causes for the testicular pain? So if testicular pain occurs to a man, he must be very careful of that, because there is a very serious conditions which causes testicular pain. So today we are going to see what are the serious conditions. One is torsion of the testis. You know, the testes are hanging inside the scrotal sac. So it's like that, the scrotum like this, and inside the scrotum the testes are hanging. So if something goes wrong, this rotates on their stomach. So if this testicle is getting rotated, the blood supply to the testis gets affected. So due to that, if the blood supply to any organ in our body gets affected, there is a death of the organ. That we are telling that necrosis, that is necrosis of the testis. So after necrosis of the testis, we have to just remove the testis. So we must be very careful of this testicular pain. If you are getting a very high severe pain pain inside the scrotum or in the testes, you have to immediately consult a doctor, unless you might lose a testis. And when the children, that I am especially telling to the parents or the mothers, when their children age around 6 months to 5 years, there is a more chance of getting this torsion. So how the people going to down, the children going to complain regarding this? They will tell pain around their balls or around their scrotum or around their testes. And on of now they are crying and very irritable. They can't drink milk or they can't feed, they can't eat. Next one, around the area of the scrotum, there is a redness of the skin. So redness, severe pain and irritability, and always the child is crying and they hold both legs tied together and crying. All these are, there is a possibility of torsion of the testis. So what you should do is immediately you consult a doctor, and immediately that child has to go for a surgery. Then after surgery, they have to untwist the testis and they fix the testis inside the scrotum. Then only we can make the testis to lie. Unless what will happen, the testis will die, a necrosis of the testis. After that, we have to remove the testis. So testicular pain, very serious condition is this torsion of testis. Second is, now normally these days some people are going to have sex with some other people. They go for a casual sex worker or family sex worker. So after you went with a lady or girl, then after 4 to 5 days, if you get a pain over your scrotum or inside the testes, what it is? It is caused due to the infection. So these infections are called sexually transmitted disease. It must be a gonorrhea, it must be a syphilis, or it must be a chlamydia, so it must be a trichomonas vaginalis. Whatever said and done, if you go with a casual sex worker or family sex worker without protection, without condom, you might get infection. After that, you get a pain inside your testis or inside the scrotum. So that we call epididymitis or epididymocarditis. Pain over the testis and pain over the epididymis. What is the meaning of epididymis? There are the testes, two testes like that. Around the testes, there are the trabeculated tube is there, it's surrounding the testis. That is called the epididymis. So that is most important. So second one is due to infection. Third one, around inside the pain in the scrotum on the testis. Third pain is due to hernia. What is the meaning of hernia? There are two holes are here. Through that hole, the stomach, not stomach, the intestine can peep out. The intestinal contents can peep inside that scrotal sac. So inside the scrotal sac. So due to that, when we start coughing, how to diagnose this? When you start coughing, the scrotum become large. That is called the indirect inguinal hernia. So the hernia also, the patient, the normal people, they get a pain inside the scrotal sac. So that is also, you will get a pain. Next one is, there's a thing called varicocele. You know, varicose vein, you know, it normally occurs in the both legs. What is the meaning of varicose vein? It's a human, it's a man, always standing and working. Or if the lady became pregnant, after the pregnancy, both legs, there are dilated vein. So like that, these type of dilated vein are occurring inside the testis. That is called varicocele. The size of the varicocele, there are different grading, grade 1 to grade 5. So if that varicoceles are occurring inside the testis, we will get the pain inside the scrotum or inside the testis. So varicocele also can get this. So how to diagnose the varicocele? Simply, we can do the ultrasound scan of the scrotum or ultrasound scan of the testis. We can get the varicocele. So these are the things causing varicocele. So next one, what are the causes of this testicular pain? So next one is very important. There is a trauma. So what will happen? At the age of between the 5 to 10 years, these children, especially boys, started practicing to ride the push bicycle, two-wheel bicycle. So in the bicycle, you can see there is a, in the center, there is a bar. So what will happen is, they are now taking practice to ride. They are not a professional riders. What they will do when they ride, they will sometimes stand or fall on that bar. What will happen? The bar come and knock the testis. After that, due to the testicular trauma, they will get a pain inside the testis. So that also must be explored. So when the child comes and tell you, Dada, Mama, there is a pain over testis, so you have to ask, are there any injury or trauma to the lower abdomen or to the scrotal parts? So today we finish this program. If you like this program, please share with others. When you're watching the YouTube, please share it, like it, and when you press the bell sign and you subscribe it. When you are following in the TikTok, definitely follow me. Thank you very much.